Welcome to the Module 12 Synopsis, Self-Care, and the Client. Now, as you know, the content for this module was in ATI, so make sure you've done all of those modules. Take a look at these objectives and make sure you've met all of them. If you haven't, go back through the ATI lessons and content and see if there's anything in there that can help you make those connections. Some factors that affect individuals' nutritional needs and habits are their developmental stage, gender, culture, religion, perceptions, beliefs about food, and many others. So when we talk about developmental stage, of course, infants and adolescents have an increased need for nutrients and calories, and older adults have fewer calories, but they need specific nutrients. As far as gender goes, body composition, muscle mass, menstruation, pregnancy, and lactation all have a role to play. Culture and ethnicity is an important consideration because there are some dietary restrictions and dietary norms that vary in that context. So why is it important to understand how to calculate a client's daily caloric need? Well, the obvious example would be in the treatment of a client with an eating disorder. At the very least, you should understand these calculations and how it applies to that illness. Obviously, this treatment is going to be multidisciplinary, and the dietitian will probably take the lead in most of that. But to be an effective part of the team, you need to have an understanding. Also, with different mental health disorders and their manifestations themselves, that can increase or decrease a client's appetite. Certain aversions and certain avoidant features, they can choose textures and types of food to avoid. Medications, they can change the taste of food with MAOIs. There's certain ones that you need to avoid. And also medications can increase or decrease somebody's appetite. So for optimal weight and function, a man needs about 2,800 calories and a woman needs about 2,200 calories. Keep in mind that if somebody is growing, they're going to need more, and if somebody's sick or injured, they're going to need more. So what are some factors that impact weight? Well, there's culture, there's religion, there is ethnicity, age, sex, a lot of different things that are not variables, but there are some variables. So large portion sizes, that in America is one of the differences from other countries. We have really large portion sizes. So a lot of people also work long hours in a sedentary setting and they're not getting enough activity. And then also there are people that in their leisurely activities or in their hobbies, they're not getting enough activity. Another factor is there have been a lot of school programs that have been cut in terms of promoting healthy eating. And also a lot of us live a very fast-paced life. Americans in general have a tendency to be, or at least perceive, they are under a lot of stress, and stress activates pathways within the body that hold on to weight. On top of that, a lot of people cope by eating. So regardless of these factors, and given that most of us live a fast-paced life and are under quite a bit of stress that can lead to weight gain, we have to remember that the risk to our physiological and psychological health is great. So find time to have those conversations with patients when appropriate to discuss healthy eating and weight management. If the idea of dietary supplements comes up, particularly in the mental health population, please defer all of those questions to the provider. They want to talk about different diets, like low-calorie, restrictive sorts of diets. Also, you want to get a multidisciplinary team involved in those conversations. Make sure that you know and understand that there are certain things that people use to help maintain a healthy weight that are not safe. Body wraps, that can lead to dehydration. Other chemicals and stimulants can have a significant physiological impact, and they are also psychoactive in that they can change behavior and mood and thinking patterns. Other unsafe products include fat burners, fat blockers, and bulking agents. So think about this. What strategy could you use to begin a discussion about healthy eating habits with a client? So let's review some information about exercise or physical activity. It's important at varying levels at different ages and with different disorders and diseases. There are wide variations in a level of difficulty. but in general, you expend energy, and it includes movement. Some general physical activity requirements for individuals is 30 minutes a day most days, brisk physical activity like housework or yard work, and resistance exercise. And actually, that's what you do with physical therapy is resistance. Some factors affecting activity levels are growth and development, physical health, mental health, nutrition, personal values and attitudes, external factors, and prescribed limitations. So, from a growth and development standpoint, there's going to be differences in how much, the way, and the toleration of movement and exercise in newborns, infants, toddlers, and preschoolers, and school age children. So, there's going to be less differences in between, but more differences in general with adolescents, young and middle adults, and older adults. Some physical and mental health barriers. Physically, you can have musculoskeletal limitations, cardiovascular limitations. There are hematologic conditions that cause a decrease in the ability to perform physically, and endocrine disorders. With mental health disorders, there's often a lack of motivation or commitment, and they need to be at a stage of readiness. Nutrition and hydration itself can impact exercise and activity. Poor nutrition inhibits movement and it impairs balance. Dehydration causes lethargy, tachycardia, and poor activity tolerance. Some external factors are the climate, proximity of facilities, occupation, culture, comfort level in groups, and finances. The major physical activity barrier that you're going to see in an inpatient setting is just their location. And also, there are people on bed rest, and that promotes recovery. But it does have an adverse effect on body systems. So keep in mind that even if somebody is in an inpatient mental health setting or an inpatient setting in general, they still need physical activity. They at least need to try to maintain their current mobility status. Some other factors that affect mobility are age. With age, you have decreased muscle tone, decreased bone density, a loss of joint flexibility, loss of bone mass, sometimes brittle and fragile bones because of calcium depletion and osteoporosis. So, something that has to do with physical activity and psychoactive substances are performance enhancing substances. They're supposed to increase strength and endurance, enhance athletic performance, bulk up, but they pose serious health risks. So stimulants, for example, you have an increased risk of heart attack, seizures, and psychosis. Energy drinks increase alertness, decrease fatigue, but they have a limited or doubtful effect on performance and can have cardiovascular and cerebrovascular implications. There are ways to safely build muscle with work, physical activity, and a balanced diet. What is one way to promote activity in an inpatient setting? So take a look at some of the main points that HI went over in terms of sleep. There's the concept of sleep versus relaxation, the fact that sleep is not a relaxation technique. There's physiological factors that impact the quality and length of sleep. Stress has a big impact on the ability to fall asleep, stay asleep, and have restful sleep. There's physical considerations, and it has to do with cardiovascular disease, there's respiratory disease, there are pain considerations when it has to do with sleep. A patient's not, or a client's not going to be able to sleep if they're in pain. And then there's some other systemic implications. Environmental factors, noise, other people, light, sounds. That's particularly important when clients are in an inpatient setting. We know that we have to take care of them, and there are checks and there's vitals and then there's all of those things, but the psychological impact on somebody that has not had enough sleep is something that we need to take into consideration when we're planning our day. There are numerous manifestations physically and mentally of not enough sleep: dulled senses, slower reaction time, there's irritability, and then in more severe forms can lead to arrhythmias, blurred vision, reduced hearing, sensitivity to pain, and impaired reasoning and judgment. So specific psychological effects are increased stress, irritability, agitation, hyperactivity, confusion, disorientation, a lower pain threshold, withdrawal, apathy, cynicism, and a lack of motivation. We do not want to stack the deck more so against our clients than they already have in their acute illness phase. So there's some sleep disorders that were presented in ATI. I'm just going to go over them quickly. You can definitely, and hopefully you have, gone into them more in detail. There's insomnia, there's the parasomnias, sleep apnea, narcolepsy, hypersomnia, and each one of these has a different type of treatment to go along with it. There are some commonalities, and it also depends on the severity and length of symptoms. What is one benefit of adequate sleep, psychological or otherwise, that you could discuss with a client? So first, let's touch on what you learned about stress. When people are under stress, it initiates a fight or flight response. There's an interplay of psychology and physiology. There's an immediate reaction. You either want to fight and defend or run and escape. Stress is responsible for up to 85% of illness. From a sympathetic nervous system point of view, there's an increased heart rate and blood pressure, vasoconstriction, bronchodilation, release of glucose, fatty acids. Our parasympathetic system helps us return to a relaxed state. There's acetylcholine involved. The heart rate decreases, so does blood pressure. Pupil size returns to normal. There's vasodilation and bronchoconstriction. There's different sources of stress, and some of them are situational and some of them are chronic. When there's chronic stress, there's no return to homeostasis, and there's this consistent state of stress. So the nurse's role and in empowerment is we have the ability to influence others, can help them take back control, establish competence, and through nurse empowerment of self-determination, meaning, competence, and impact, we can really have an influence on how patients perceive and how they react to stress. So some ways that stress can be managed is through attitude, cognitive restructuring, conflict negotiation, conflict resolution, and reframing the situation. We also innately have and can build up resistance to change. And counseling can help a lot of clients in coming up with individual strategies to help them manage their stress. So what about health and wellness? There's a concept of health. It's changing, and there's a physical focus, but there are also emotional dimensions of health. The use of emotions, coping with problems, expression of emotions, control of emotions, and behaviors of emotional health. There are also intellectual dimensions of health, being open to new ideas, learning from life experiences, thinking clearly and analytically, and using brain power effectively. And there's also behaviors that demonstrate this. What about spiritual? Harmony and balance, ethic, values, and morals, and meaningful life, optimism, and forgiveness. So, occupational dimensions of health, enjoyment of work, contribution to society, and the ability to earn a living. Social dimensions of health are performance in social roles, skillful interactions with people, skillful interactions with society. And then there's the physical dimensions of health. Maintaining a healthy body by eating right, exercising regularly, avoiding harm, making responsible decisions, and seeking medical care, preventing illness. As nurses, we always want to make sure that we're applying Maslow's hierarchy to client care. We need to use the hierarchy to prioritize care, respond to the client's needs, meet physiological needs first, advance them through the higher levels, and distinguish your priorities from the client's needs. Health promotion. This is a positive approach to living. Focuses on well-being, satisfaction, enjoyment, control over health, and a positive approach to health improvement. Disease prevention. So the World Health Organization has a concept of disease prevention, and it focuses on risk factor reduction, arrested progress, reduced consequences, and activities that avoid illness. Last but not least, always remember your levels of prevention: primary prevention, secondary prevention, and tertiary prevention. There are hindrances to optimal health and wellness. have living a hectic life, lack of education, lack of understanding, unhealthy attitudes and behaviors. Well, that's it. Well done, everybody, and keep up the momentum.